Hello and welcome to the Yoga by Candace YouTube channel. Today I wanted to do a little practice for anyone who's dealing with a low back issue, L4, L5, S1. That's typically like the area most people in their lifetime will deal with that at some point. And if you're in the middle of it, I'm really sorry because it is actually the worst. I need to tell you two things before we start. One, you're going to need a couple pieces of equipment to do this practice. You will need 2 yoga blocks. I'm using cork blocks, but it doesn't really matter what kind of blocks you're using. You will need a dumbbell. I've got a 15-pound dumbbell here. Use whatever you have at home. It's just going to help us for a mobility drill. We're going to need a more challenging resistance band. This one is by Bosu. I'll link it. And then you're going to need a lighter mini resistance band. This is like an extra light one. The other thing I need to tell you is that I'm going to be speaking a little bit more than I usually do, because the thing about a low back issue is that the culprit usually isn't the low back. It's usually got something to do with either glute weakness, core weakness, or pelvic floor issues, or hip mobility issues, or all of the above, some combination of those. So I'll be speaking a little bit more because I need to teach you like how to integrate your pelvic floor with your core brace, how do we actually core brace, etc. So I apologize for the excessive talking, but it is what it is. I gotta get you that information. Now, because the low back issue typically isn't within the low back, it's one of the other things I just talked about, you will find that stretching alone probably feels good in the moment, but it doesn't really get to the root cause. So while this one video may give you a little bit of relief, it won't be the thing that fixes the problem. The thing that fixes the problem is beginning to strengthen your glutes, your core, your pelvic floor, learning to integrate your pelvic floor into your core as you move, finding better movement patterns, finding improved mobility throughout your entire body, probably definitely the hips, but also maybe in the shoulders, neck, etc. And learning to move a little bit more optimally in your activities of daily living. So it's going to come with time. Full disclaimer, this one video alone isn't going to fix everything, but it's a good place to start. Down in the description below, I will link to my posture program, which is another good place to go if you're looking for a little bit more support. So in this video, we will do mobility, we will do some activation, and we'll do a little bit of stability work as well. So let's first talk about the core brace. You can think of your core as you have like 2 parts to it. You have your hips, and then you have what's known as like the core, right? So if you think about the spine, the human body, your spine, the upper part of the spine has the rib cage that goes around it, and that helps to protect that part of the spine, the thoracic part, from any kind of issue. So usually like a thoracic issue, you don't really hear about those very often because the ribs are there to kind of help stabilize and protect. Most commonly, people will have issues in the neck, cervical spine, or the low back. And that is because if you think about how our bodies are made, we just have like musculature through the neck and musculature that's supposed to be there through the core to help us, but quite often they are underdeveloped, and then we get those issues. So I want you to think of like this as your hips, almost like a bowl. And then let's think of this as your trunk, this dumbbell here. I'm gonna come a little closer. So if I turn to the side, you want things to be somewhat even. You want neutral hips, which would mean the block looks like this. But a lot of people have either this upward tilt in the back from the tailbone, meaning there's an anterior tilt. They stand like this, they walk like this, and your low back gets very tight here. When your hips tilt forward like that, the trunk kind of has to tilt back in order to compensate. So the posture might be like this, where the hips are tilted down and my rib cage is kind of now pointed up. If you think about what that does to this area of the low back, it's kind of putting some pressure and compression there. So one of the things you'll need to think about is how to begin to stand a little bit more evenly. Now, commonly people will say to tuck the tailbone, but if you tuck the tailbone, now you've gone from this to this, which is you've kind of lost the lumbar curve of your spine. And you don't want to do that. So I wouldn't suggest to start tucking your tailbone, because then you'll start to stand like kind of like that. And if you look around, you know, at the grocery store or other places that you visit in life, you're going to see people who stand like this. And what that does is it straightens out the lumbar spine, and then also can create some tension and discomfort in the low back. Now, if you are tight through your hips and you are somebody who sits for prolonged periods, maybe at your computer or at a desk or whatever, you may find that this part of your low back is lengthened because of the hip tightness, because you're kind of crouched over at your desk. And this prolonged sitting creates a lot of stress and tension for your low back. So again, the fix is trying to think about how to come from this position into a more neutral position. You want the cylinder of your rib cage to just sit neutrally right over the bowl of your hips. So one of the first things we can do for mobility is just feel what it feels like to move your hips in that sensation. So bring your hands to your hips. Your feet are going to be about hip distance. And let's just start by doing some what's called standing cat-cow. So your knees are soft, and you'll tilt your tailbone under as far as you can go. Just think about like pointing your tailbone forward if you can. And then lift your tailbone as high as it'll go. And then tuck your tailbone a whole lot and lift a whole lot. And then see if you can do it with the integration of your rib cage. So almost kind of like a crunch, like you're doing a sit-up but standing, and then a back bend. Lift your tailbone, lift the front of your ribs up. Now point the front of your ribs towards your hips as you tuck your tailbone, and then lift the front of your ribs up. Let's do that 2 more times. We go down. You can get your head involved because your spine is always going to follow where your head goes. Last time, chin to chest, front ribs to hips. And now lift up from the tailbone, lift the head, rib cage tilts back. Now let's see if we can do it with just the movement of the hips. Try to keep your ribs stable. Now if you have a mirror in front of you, that's going to be really helpful. So you can watch that make sure that your ribs don't move. So we're just tucking the tailbone and lifting the tailbone without trying to move the hips. If you have a mirror in front of you, I would turn to the side so you can really see that your ribs aren't moving. Whew. Okay, let's shake it out, and then let's go down to hands and knees. So we're in a quadruped position, hands underneath shoulders, knees underneath hips. We're going to do that same thing, lifting head and tailbone, lowering through the belly. Then exhale, point the top of your head down towards the mat, tuck your tailbone, and reach your front ribs towards your hips. Breathe in, lift head and tailbone. Breathe out, round your back. Breathe in, really long, deep breath. Breathe out, chin to chest. One more time, breathing in. And exhale. Great. Now I want to explain how to brace your core. In order to brace your core, you need to understand your diaphragm. Your diaphragm is a muscle that sits right about here. As you breathe in, it's going, and as you breathe in and out, it lowers and it lifts. So begin to think about the length of your breath and the depth of your breath. A lot of us breathe really shallowly, particularly if you're prone to anxiety. You might notice that you breathe kind of shallowly. You want to try to find deep breaths, not a belly breath that expands your stomach or anything, just a long, deep inhale. You can almost think about your ribs expanding out to the side as you breathe in, and they come back together to neutral position as you breathe out. So let's just try that right now. Go ahead and close your eyes. You can bring your hands to like the sides of your ribs, and then as you breathe in, breathe into your hands. As you breathe out, feel your hands come back to their starting position. Breathe in. Breathe out. Try to make your inhales and exhales as long as you can. Breathe in. Breathe out. One more time. Breathing in. Breathing out. Fluttering your eyes open. I want you to envision like a deflated balloon that's deep, deep inside the center of your body, right through here. So that as you breathe in, that balloon, yes, expands out to the side like this, but also I want you to think about it expanding into, if you had a hand here and here as well, you'd feel that expansion on the inhale and the exhale as well. So it's like a full 360-degree breath without it being too effort-based. I want you to just breathe naturally, but intentionally, and not trying to fill up the balloon or, deflate the balloon as fast as you can, just natural, calm pace. So I would suggest hands here, because most of us know how to breathe here, but hands to the side, or maybe one hand to the side and one hand to your back if you have that mobility through your shoulder. And then go ahead and close your eyes, and once again, we're going to take 5 deep breaths at your own pace. Great. Flutter your eyes open. Now we need to think about how to integrate the pelvic floor into your core, into your breathing, and then we're going to practice the core brace. So this is, I apologize for not moving really quick, but it's really important that you understand breathing mechanics and then how to brace your core using those breathing mechanics. So your pelvic floor. Your pelvic floor is like a diamond shape set of muscles that's right here. Everybody's got a pelvic floor. Doesn't matter whether you're male, female, whatever. Everyone's got pelvic floor muscles. You can think of these diamond-shaped muscles almost like a hammock, right? They sit at the base of your hips, right? So as you breathe in, everything expands here. Everything also expands through the pelvic floor. You're thinking almost like a descending of these hammock muscles a little bit. It's not intense. It's not something you have to try to do. It just naturally happens. As you exhale, that the muscles in the hammock muscles, start to lift up a little bit, okay? So I want you to just see if you can experience that or find that mind-muscle connection. It truly is like a mind-muscle connection. What I think is helpful is if you lay down on the ground and on your back and your legs are bent and your feet are down on the mat. So go ahead and do that. Hands will be touching your ribs on the side. And then you're just going to relax your entire body. Go ahead and close your eyes. And then breathe in, feeling the expansion into your hands and maybe feeling the descend, the slight descend of those hammock muscles of the pelvic floor. And then as you exhale, feel your hands come back to their starting position and the hammock muscles of the pelvic floor to gently lift up. Take 3 more breaths on your own, just like that, long, deep inhales and exhales. Okay. Flutter your eyes open. Now we need to talk about how to gently brace the core. So, the way I like to explain it is first taking your hands below your lowest ribs. So like my belly button's right there. I'm at the side of my belly button essentially. Now your core will brace on its own automatically when you sneeze, when you cough. So I think the best way to explain it is to have you clear your throat or cough and you'll feel the automatic brace of your core as you do that. So go ahead and take your hands here, the soft part of the sides of your belly, and then clear your throat. Go. You'll feel everything just kind of tightens up and comes to center. Notice that it goes inward, not outward. So go ahead and clear your throat. Go ahead and do it again. Now see if you can bring awareness to what's happening at the pelvic floor. You might, because you haven't maybe been paying attention your whole life, it might be very difficult to do right now in this moment, but you're just learning it. So give it a try, see what happens. The lift of the pelvic floor comes when you brace your core, and you need to kind of think about a gentle lifting up a little bit. It's not a Kegel, it's not an intense tighten. It is sort of like the sensation when you walk into a cold pool or lake and you're getting in the water and the water is coming here and here and you're like, oh, this is kind of cold. And then it gets to about here, just over your pelvic floor muscles, and you're like, it's that sense of lift up, but it's not an intense, it's not that. It's just a very gentle lift up. I don't know how else to explain it. That's what I got for you. If you have a, oh my gosh, I don't know what I'm allowed to say on YouTube or not. If you are somebody who gives birth and you want to put a finger in that area, you could theoretically like gently tighten around that finger and lift up. That is like the sensation. If you are not somebody who has that part of a body and you have something else, I would say it is just the sensation of kind of walking into cold water, very gentle lift up, but not an aggressive tension or tightness. Now, there are degrees to how much you can brace your core. If you're just doing a cough, your body is going to gently brace a little bit. But if you are going to lift up really heavy weight, you're going to think about bracing it like an 8 or 9 out of 10. Very difficult, like very intense brace, very intense lift of the pelvic floor. And then you hold that brace as you pick up the weight, right? So there are a couple skills that need to be learned as you are rehabbing from this back issue. One of them is, am I bracing my core when I go about my life on a day-to-day basis? Or am I just kind of like going about my life without thinking about bracing my core? And if you're the latter, I would suggest thinking about trying to brace your core as you go about your daily activities, just for like, I don't know, the next few months, and see if you are bracing appropriately. If you have a child, let's say your kid is like, I don't know, 3 years old and you're giving your kid a bath. When you lean over to pick your kid up out of the bath, are you fully rounded here and not really thinking about it, and therefore your back is kind of aggravating? Or are you thinking about bracing the core, sending your hips back, and picking your kid up just as if you're doing a deadlift, right? Now, I'm not saying that for the rest of your life you need to walk around like all stiff and like doing these deadlifts to pick your kid up out of the bath. I'm just saying that when you are dealing with a tremendous amount of pain, but you still need to go through your activities of daily living, like bathing your kids or putting on your shoes or whatever, putting your pants on, like those are all hip hinging movements that I would suggest you do with a braced core to the appropriate degree of whatever the activity is that you're doing, and helping your body find new movement patterns that better serve you in this current chapter of life. There will be a time when this back issue is gone and you can move through your life without really having to think about it too much, but it's always just a good skill to have. So that's the first thing. The second thing is when you start to incorporate exercise that requires some core bracing, you need to be able to hold that brace while you breathe. And that is a real skill to learn how to do. So let's practice that. Let's practice that by coming into a kneeling position, hands to your belly, and go ahead and brace your core gently, like 20%, 30%. And if you're not quite sure how to do that, clear your throat, feel and hold that core brace and make sure your pelvic floor is lifted. So I am holding a core brace and I'm able to go all the way around, tapping my torso at the soft part of my belly, and I can feel that there's tightness and tension. I am bracing my core and I have a lift of the pelvic floor at the same time. Now go ahead and let that go. And now you should be able to tap, 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 tap. If there's nothing going on, you'll be able to feel that you're not bracing. So go ahead and find an integrated brace with a pelvic floor lift, or clear your throat to make sure you're doing it. And then hold that brace as you breathe. And when you breathe, you're going to take a little sip of air just up here. So you're going to hold this. You can use one hand to tap and make sure you're holding that core brace, and then take a little sip of air while holding that core brace a little bit. Go ahead and do it again. Great. So now we're going to integrate that into the move that we're going to do, which is a dead bug. No, a bird dog. You're going to take your block and you're going to put it on your sacrum. So your sacrum is like, it's like right about here. It's this like triangle part of the upper part of your hips, not on your low back. So you're putting it here, and then you're finding a core brace and a lift of your pelvic floor. Once you have it, slowly begin to extend your left arm and right leg and try not to let that block topple over. Now you're moving with so much control and your core is braced hard as you move. Go ahead and switch. And bring it back to center and switch. Now as you move, go ahead and move at your own pace, but focus really hard on maintaining the core brace as you extend. And when you extend your legs, see if you can flex your feet. Inner thigh spins up towards the sky and you're pushing into an imaginary wall. Now if your block topples over, that likely means that your core wasn't braced properly, because the core, when braced, ideally is stabilizing through your hips. Let's do one more each side. And if you're not sure if the core is braced, you can always just tap your stomach or your side and see. Go ahead and release. Great. So that is a move that you can start to integrate. That's usually really safe for L4, L5, S1 issues. Now we're going to move on to a dead bug. So you're going to bring the block just above the knees and go ahead and lie down. Lift your legs up and then find a core brace. Now this can be difficult for people, and people will often rely on the hip flexors or other parts of the body to help them get through this move. But go ahead and try to find a core brace. If you're having difficulty with that, you can use your dumbbell and think about pushing it up to the ceiling. Keep your head down, but push the dumbbell up so your shoulders are off the mat. Squeeze that block together and try to maintain the core brace as you tap your heels down on the ground without lifting up through the low back. And we'll do this 5 times, trying to keep that core brace as you breathe. You're thinking about buttoning up or zippering up through the whole front part of your body. It's almost as if you are wearing a corset or one of those like waist trainer things that you might see. Tap. Let's do 2 more. Great, and last one. And lift. Great. And then set the dumbbell and the block off to the side. So yeah, if you're having trouble like understanding the core brace, imagine one of those waist trainers. If you don't know what I'm talking about, just Google waist trainer. It's like a big corset thing. Please don't buy one. There's no actual evidence that they actually work, but the way that they fit on your body, they're like from here to here, and they button up really tight. And if you imagine yourself wearing that, that's going to help to integrate the core, but then don't forget to also integrate the pelvic floor. Because if you are just thinking about squeezing this part, you're actually putting pressure down into the pelvic floor. That can lead to bladder incontinence, etc. We don't want any of that. Okay, so that dead bug variation that we did with the tap of the heels, that's another great move to integrate into your rehab. The next thing I want to talk about is a little bit of hip mobility. So this is an exercise I pretty much never see anyone do. So it's a really good one to incorporate. So you're going to put this block between the knees, above the knees. I'm going to turn because you need to be able to see where my legs are going. So you want to have your knees, think about your knees being magnetized towards your shoulders, like they're trying to come in towards your shoulders. And then they're also pressing the block together. They're squeezing the block. Your feet are flexed, and then you're going to drive your feet out to the side. Now, the tendency is for the toes to want to turn out to the side. Don't let that happen. Toes are pointed up towards the ceiling, and you're driving the knife edges of your feet as far as they'll go out to the side. Now, if you look at your legs and one leg only wants to go like to here, and the other leg can go out a whole lot, well, then you know that this is the hip with the more limited mobility. So drive as far out as you can. If you're doing this right and you have some limited hip mobility, you will likely feel a little bit of a cramp happen on the side of the hip, right about here. That's just a neurological response to what's going on. It's like your body's like, oh my God, we've never felt this before. What's happening? I'm going to cramp up to protect. You can just come out of the move and then get back into it. So let's do this like 5 times. This is called internal hip rotation. It's a position our hips are very rarely in. And release. Go back into it. Now just make sure, take a look at me and make sure that you're doing it right, because a lot of times I notice that people, especially people with weaker cores, their knees will be further away. You kind of want your knees like just above your hips, maybe even in a little bit more from the heads of your femurs. And then relax. Let's do it 3 more times. Open up as wide as you can. Hold, 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 hold. This is another one of those moves that you could just do all the time as you rehab this. Make sure your toes are pointing straight up to the ceiling because they're going to probably want to turn out to the side. Whew. Last time. Opening up wide and release. Now, while we're here in this position, let's just bring the feet down as close to the hips as you can get them, pressing through your heels and gently bracing your core. You're going to lift your hips as high as they'll go. Now, as you're here, think about keeping your hips neutral or even tucking your tailbone under a little bit. Squeeze your glutes firmly. Try to hold the squeeze of the glutes as you lower your hips down. Once your hips touch the mat, get them right back up. And we'll do this 8 times. Exhale, lift. Holding the core brace. Let's go 4 more times. Pressing through your heels primarily, trying to hold the squeeze of the glutes. Last 2 times. And last time. Great. Gently release. You can take that block. Now we're going to go into 90-90. So let's do right leg out in front. You want your knee directly in front of the head of your femur. Your femur is this long bone here, head of your femurs are right here. So the knee is going to be right in this same position, and then this knee goes out to the side 90 degrees. Make sure your feet are in the proper place. So you want your ankle aligned with your knee, not too far forward, the tendency is for it to be too close to your pelvis. So just look down, make sure it's where it needs to be. This back one, you don't want it to be too far towards your hips, and you don't want it to be too far away. You want it to be directly in line with your knee. Then what you can do, because you may not have the mobility, you might be like, oh God, this is a lot, I can't do more. You might need to use your block to try to encourage your spine to be perpendicular with the ground. So that's your first goal, is to try to comfortably come here. Your second intention is to push down into your back knee, not with your hand or anything, just have the mind-muscle connection of squeezing this knee down into the ground. And you're pushing and you're holding and you're trying to stay perpendicular. You're sort of leaning in this way. And if you're doing it right, you might have something going on through the side of the hip. That's, again, hip mobility. We're doing a little bit of hip internal rotation when we push down. And we're working to create some more movement within this hip capsule. Woo! And then release, and let's do the other side. So again, this knee is right in front of the head of the femur. This ankle is in line with the knee, not out in front, not too close to the pelvis. Back knee is directly out to the side, and then back foot is not too far in towards the hip and not too far away. It's just directly in line with the knee. You can use the block to help you sit up so that your spine is perpendicular to the ground, and then you're applying a little bit of pressure into this floor with the back knee. Just hold here. Great, and release. So these are all moves that you can do as you continue to work on your rehab. We're going to go back into that quadruped position, and from here, curl your toes. Make sure that you're not sinking, that your core is a little bit engaged. Pelvis is neutral, rib cage is neutral. And then send your hips back. Move from your hips and press into your big toes. Can you get a big stretch across the bottoms of your feet by pressing into your big toes, because your toes are curled under. You can put a little more weight in one side and then the other by kind of shifting your weight side to side. Remember, keep your core a little bit engaged here. Don't sink with an arched back. Okay, gently release. You're going to roll over onto your right side. Pull your knees in towards your chest, not too far away, in towards your chest, and both arms are reaching out away from you. Head can be on your block if you want, so that it's aligned with your spine. And then as you breathe in, you're going to open up. Your head might come off your block. You're going to open up and reach the top arm towards the ground. Try to move from the shoulder. Can you get that shoulder towards the ground? And come back to center. Now, if you are somebody who's super, super tight through the shoulders, what you can do, this dumbbell is a little bit, it's definitely way too heavy, but if you had like a 3-pound dumbbell or a 5-pound dumbbell, and you're like a big dude, or big, I don't know, you're just like a person who's extremely tight. Typically in my clients, I see it in like older men, but people who are extremely tight through the chest here, they might need the weight of a dumbbell to help open up. So you could take that 2 or 3-pound dumbbell or 5-pound dumbbell and then open it up and let the dumbbell pull your arm and your shoulder towards the ground. And then go ahead and exhale and close. So you're trying to keep this somewhat dynamic. Let's do it one more time. Breathe in and open up, reaching the shoulder down towards the ground. And release. Then, of course, whatever we do on one side, we're going to go ahead and do on the other. Option to use that block or not. So now you're on your other side, and you'll open up. Knees are pulled in towards your chest. Follow your top arm with your eyes. And turn your head and look out over your shoulder. And then go ahead and close. And breathe in, open up. And if this top knee wants to come with it, you can just push into it with your other hand. And close. And then last time, open up. And close. Great. From here, we're going to go into using that band, the heavier band. You can put that just above your knees. Now, if you have trouble with your balance, you can use like a chair or something to just hold your hand, like put your hand up against, but try not to like rest on it, you know? I could use this foam roller if I wanted to. All right, so looking down, let's put all the weight on the right foot. Right foot is pointed totally forward, not out to the side. Then you're gonna find some resistance, making sure that the left toes stay forward, not out to the side, because if you're out to the side, you're gonna use your TFL, which is this. I want you to start using your glute medius. You're gonna take your leg out to the side. Now, just continue to move. I'm gonna keep talking, sorry. You have some options. This is the kind of beginner-friendly version. I would aim for like 12 to 15 of these. When you get to a point when 12 or 15 is a little too easy, you can level it up, making it a little bit more challenging by going mid-shin. And then if you get to a point where 12 or 15 at mid-shin is pretty easy, you can go to the arches of your feet. So the lower you go, the more challenging it's gonna be. So let's do 5 more. 5, 4. See if you can integrate the pelvic floor lift with the core brace. 2 and 1. Now, a lot of times people will be like, wait, I feel it on this glute, but this is the one that's working. No, let's switch sides. As long as you're feeling it around here, you're doing it right. It doesn't really matter which leg, because, go ahead and start on this side. Make sure your toes are pointed totally forward. When you are stabilizing with this leg, this glute is doing the work. This glute is lifting this leg out to the side, so you may feel that there as well. Let's do 5 more. 5, 4, 3, 2, last 1. Great, go ahead and slide that off. All right, grab your dumbbell. Let's come into a kneeling position. So you just want to be sure that when you're in this kneeling position, you're kneeling with even hips rather than anteriorly tilted hips. It's really important. So if you have a mirror, I would position yourself so you're looking at yourself from the side, and you can see that when you go into this, not only are your hips in this even position, but your ribs are in an even position. And we're just gonna go straight up overhead like this, and just make sure that you're not here with it, because that means that your shoulders aren't actually doing the work. The mobility of the shoulders isn't really happening. The core isn't quite there, and your body is compensating. So you have a couple options with this. If this is a little bit more challenging and you're finding it very difficult to position your body in the right place, bring the opposite foot forward, stiffen your whole body, and then go up and down like this. I would aim for like 12 to 15. And when that gets easy, you can go back to this version. Let's do 3 more. And you can always just touch and make sure that your ribs are in the right position. Let's go to the other side. So you're looking to keep a core brace, a pelvic floor lift, and then as you move, if you've got your one foot out in front of you, just make sure that this knee isn't moving, that it's firmly, the foot is firmly planted into the ground. The core is strong, the ribs aren't flaring, arm is in line with your ear at the top. Let's do 3 more. Last one. Great. Set that down. Then you're going to grab your lighter band. You have a couple options with this. You can do it foot flat on the ground, but a lot of times you need a little bit more range of motion. So I would step on your block. So you have a light band on. You're going to step 1 foot on the block. Make sure that foot is pointed totally forward. The band is around your arches. Your core is on, pelvic floor is lifted, and you're going to pull your leg up. You're flexing this foot, and you're looking at yourself in the mirror from the side, making sure that your hips are neutral, trying to make sure that your hips aren't tilted to any one side, they're even. I would do like 15 to 20 of these. And again, if you need something to balance on, you're going to just use this for a little bit of balance. Now, always make sure that you have some tension. If you like lose that tension, then you're not really working. Let's go ahead and switch sides. If you're somebody who's like, oh yeah, I always have core issue or balance issues. Balance issues are usually a core thing. So focusing on deep core work, so not sit-ups, not things like that, that work your superficial muscles, but the deep core muscles, like the dead bugs, like the bird dogs, like that press that we did, like this. This is working your hip flexors, but it's also working your core as well. Let's do 3 more. Last one. And done. Woo. Okay, so that does it for our practice. I hope this was helpful. My goal here was to give you a number of different things that you could do to help to start working on the low back issue. And like I said, this isn't going to be a one-time quick fix. This is something that usually needs to be worked on for quite a while. But all of the skills that I touched on here should be really helpful to you. And if you need more support, you can check out the link in the description for my posture program. I hope that helps, and I'll see you very soon here on the Yoga by Candace YouTube channel.